Hello everyone. Hello everyone, and welcome to this audio podcast. This audio podcast is part of the syndicate. This audio podcast is part of a Bostic syndicate. This audio podcast is part of a Storm and Saga. This Storm and Saga analysis, and this audio podcast as part of the Squallish edition or series, and this audio podcast is part of a Storm and Bostics production. So through the literature, there has been through literature, through the literature, sort of medical and clinical literature, and in around sort of public health regarding literature, if you like, there have been sort of there have been sort of there have been published works looking at the use of electronic patient records or healthcare records. And so in this audio podcast, there'll be a sort of an overview in as part of EPRs or electronic patient records. So to begin with, the role of information communication and technology, or ICT. So ICT plays sort of a major role in improving the access, the efficiency, and the quality, and the effectiveness of processes relating or regarding to healthcare. The concept of e-health, as part of ICT. ICT is now and has been sort of a common basis or commonplace. Allows a sort of a sense of rejuvenating or reinventing the sort of classical modalities of the role in and of the role of ICT. At the same time, ICT allows a sort of sense of more interlink amongst different healthcare professionals, different MDTs or multidisciplinary teams, and where healthcare services for healthcare service users is and can be more can be more can be more can be sort of more user friendly in amongst different healthcare sort of settings. At the same time, the documenting of pharmacotherapeutics can also be improved through EPRs or through EPRs and ICT, and all healthcare professionals can sort of manage can sort of manage more and more in around aspects pertaining to pharmacotherapeutics more efficiently or effectively in through the use of EPRs, and the quality and in on the quality of medical services or clinical services, and hospital services, where clinical medical services and hospital services can be enhanced or better. Additionally, healthcare professionals can effectively work together, coordinating activities, sharing knowledge about recipients in a sort of a more efficient in a sort of more efficient ways. Healthcare systems enable recipients or patients to also have a sense of more control on and around well-being by accessing personalized and qualified health information, and accessing appropriate clinical care. Treatment methods can be improved. Healthcare or health professionals can manage activity more efficiently, and the quality of hospitals and medical services or clinical services can also be better established. Now looking at a little bit in around e-health and kidney care or nephrology care. So e-health is E-health is health services, is a form of a healthcare service and where information is delivered through the World Wide Web, World Wide Web or the internet, and through regarding modalities. E-health has the potential to extend kidney care beyond traditional confines and care that is integrated or it can that is integrated or can be linked into routine as part of routine public health emergency caused public health services or public health emergency services have caused wherein the pandemic had propagated the urgency of integration of e-health into healthcare service in part of healthcare services, and wherein there is and has been a requirement to limit direct face-to-face contact at healthcare facilities. E-health is potentially used to transform renal screening or renal screening and parts of diagnostics. The Health Information and Technology Working Group had been established to facilitate the identification and management of recipients with CKDs using EPRs. So now looking at EPR, EPRs more sort of in a sort of an overall way. So digital version of patient or recipient medical healthcare records can contain demographic information, diagnoses, biometric and vital sign information, care plans, polypharmacy information, laboratory investigations, and radiology investigations. EPRs can be accessed. So in more recent sort of developments and technologies, their EPRs can be accessed by both healthcare service providers and healthcare service users through internet interlinkages and with functions with a basis to support care related aspects. EPRs are used to provide alerts. Can be used to provide alerts and decisions for the management of particular symptomologies, and EPRs have allowed in around for screening for particular conditions or healthcare conditions, and helping the identification of potential and also where EPRs have been utilized as a way for the identification and recruitment of candidates for research and clinical trials. Self-management by tracking and presenting data and providing individualized recommendations have also been sort of looked into through the use of EPRs. And now going from EPRs to telehealth, although there are some sort of synchronicities between telehealth and EPRs. So the use of digital devices such as video conferencing and digital medical or clinical apparatus or equipments to allow interactions between service providers and healthcare service users have been utilized to bridge geographic hindrances. Telehealth allows remote visits for healthcare service users. multidisciplinary care visits for recipients with multiple service providers can be of advantage can be of advantage. Video consultations with different healthcare professionals and healthcare service providers additionally can be can be useful. Telehealth for urgent visits and with healthcare service providers, for example, where patients sort of pre and post transplanted recipients, solid organ transplanted recipients, can be advantageous in amongst other particular healthcare conditions. In regard to and as part of mobile e-health, the use of mobile devices devices such as personal digital assistants, for example, mobile phones or smartphones, tablets and smartphones, can be utilized to provide clinical and medical care. Modalities of care or healthcare can include, for example, sort of the simplistics around, for example, text messaging and through mobile apps. Mobile apps for polypharmacy for polypharmacy surrounding particular medical and clinical conditions have been evidenced in amongst sort of in amongst varying literature. At the same time, educational apps for healthcare have been sort of evidenced to an extent, but educational apps in context of mobile e-health have not been formally made part of medical and clinical healthcare services. Additionally, smartphone cameras in around mobile e-health to read, for example, urinary test investigations to detect in around urinary tract infections, for example, have been evidenced, and arterial blood pressure or ABP monitoring and transmission of data to healthcare service providers have been as part of in around particular conditions in and through a smartphone or mobile apps. And additionally, there are electronic or digital sort of pharmacotherapeutic pharmacotherapeutic apps to monitor in around adherence and also prompt sort of reminders in around particular healthcare conditions and so in as part of additionally now looking at websites healthcare. So a program delivered through a website and interconnected devices such as computers and smartphones, for example, can be advantageous. At the same time, educational modules for educational or e-health online modules for recipients with and going through different healthcare conditions is and can be pivotal. In as part of social media, website and mobile sort of mobile sort of mobile sort of interfaces that sort of serve as platforms for sharing and understanding in around lived experiences, and especially in around the sort of clinical and non-clinical sort of the clinical excuse me, the clinical and non-clinical aspects. Um, and additionally, sort of where social media in and through at least in through two social media platforms, for example, where the platforms through social media allow healthcare service users, carers, parents and guardians, for example, etc., to share lived experiences in amongst different forms of KRT or AR and in on RRT and in around other particular sort of conditions. And additionally, where social media through the social media platforms, for example, have heightened the awareness of and in around different or varying forms of CKD or chronic kidney disease. And finally, in as part of this audio podcast, looking at the challenges for adapting sort of e-health. So e-health can enhance detection and monitoring, but can introduce safety concerns owing to designs and tech failures or invalid data. Recipients with different conditions or healthcare complexities need would need would need to would need would need a healthcare where healthcare services through e-health in such ways where sort of complements and is suitable to traditional face-to-face sort of healthcare services. Certain aspects of, for example, physical examinations, such as examination of wounds, of in around wounds, for example, in around wounds and in around sort of surgical wounds may be challenging to perform sort of routinely through e-health consultations. At the same time, offering sort of education through online or e-health modules and sort of through smartphone apps or text messaging may not fully address the complexity of patient or recipient queries. That draws this audio podcast to a close. Excuse me. This audio podcast to a close. This audio podcast is part of the syndicate. This audio podcast is part of the Bostic Syndicate. This audio podcast is part of a Storm and Saga analysis. This audio podcast as part of the series or edition, the Squallish, and this audio podcast as part of a Storm and Bostics production.